Ever wondered what happens when you call 111? Let's look at what takes place at St John to ensure patients receive the right care at the right time. When you call 111, an operator will ask you which emergency service you need: fire, ambulance, or police. If you need an ambulance, your call will be connected to us. It will be answered by a call handler in one of our ambulance communication centres. St John manages communication centres in Auckland and in Christchurch. Our call handlers are highly qualified professionals, supported by an internationally accredited system to triage patients over the phone. A call handler will first ask where your emergency is, and you must be precise with the street address and suburb, especially if you're calling from a cell phone. When our call handler has found your exact location, the details are put into the computer-aided dispatch system. Next, our call handler will ask for your phone number and then say, "Okay, tell me exactly what happened." On listening carefully and understanding what you've said, our call handler will ask a series of clinical questions. Your call will be summed up as one of over 1,500 endpoints. All endpoints are grouped into 5 priorities that have been assigned by the St John Medical Director. Our incident priorities are: purple, immediately life-threatening, for example, cardiac arrest; red, potentially life-threatening or time-critical, for example, chest pain; orange, urgent, potentially serious, but not immediately life-threatening; green, neither serious or life-threatening; and grey. These incidents require further clinical assessment. As soon as we assign a priority to an incident that needs a resource, our dispatcher will organise it. For high priority incidents, an ambulance may already be dispatched before you finish speaking with our call handler. Our resources include many levels of clinical skills. For example, first responder, emergency medical technician, paramedic, and intensive care paramedic. These may respond in an ambulance, rapid response car, or even by motorbike. Our computer system helps our dispatcher match the clinical skill with the best mode of transport. Our communication centres also coordinate air support, like helicopters, and can arrange police and fire services if needed. For purple and red incidents, our dispatcher will send the response straight away, and it will travel using lights and sirens. For orange incidents, the response will also be urgent, but it may travel at normal road speed. Incidents categorised as green will be dispatched as soon as possible, but depending on workload, may take some time to arrive. Grey incidents will be referred for further clinical assessment by a nurse or paramedic to determine the best care for the patient. So let's look at a scenario with a high priority incident. You have found someone who has collapsed and is not breathing. Our call handler will immediately generate a purple incident, and an ambulance and fire appliance will be dispatched straight away. Our call handler will stay on the line asking you questions and will provide instructions until the triage process is complete. Our dispatchers monitor the incident and send information to the ambulance crew as they respond. Our call handler will give you instructions which may include how to position the patient, how to check for breathing, and how to do CPR. You will be asked if there is a defibrillator or AED available, and if so, send someone to get it. We will stay on the line with you for as long as possible when a patient is not alert, is having a cardiac or respiratory arrest, choking, or if there is an imminent childbirth. And here's a scenario with a low priority incident. If the patient has symptoms that are not classified as serious, life-threatening or time-critical, for example aches, pains and vomiting, our call handler will complete the prioritisation assessment and then advise you what will happen next. We may send an ambulance or tell you to keep the line free, so a registered nurse or paramedic can call you back for a further clinical assessment. The outcome may include self-care, referral to a GP, attending a local accident and medical centre or other community health provider, or an ambulance may be sent. Whatever the priority, our call handler will give you clear instructions and tell you what to do next. including calling us back if anything changes. At St John, we respond to 111 calls 24 hours a day, 7 days a week. Our highly trained staff, backed by first-class systems, provide a complex yet robust service that ensures patients receive the right care at the right time. We're proud of our ability to quickly locate, assess, and dispatch the best emergency care across New Zealand. We're here for life.